Okay. At first glance, it kind of seems like Medicare is just kind of basic stuff, and you'll just, covers your health care, and there's not a lot of other things to know. But as you'll see after the presentation, it can get pretty complex. So there's a lot of important things that benefit specialists review with an individual that we're working with. So Medicare is a federal program. It is overseen by CMS, Medicare and Medicaid services under Health and Human Services. The decisions that decisions about Medicare are made by Congress, the politicians in Washington, and Social Security and Railroad Retirement will handle the enrollments for the Medicare program. So there are 4 different individuals that could qualify for Medicare. If somebody is 65 or older, they can apply for Medicare. Somebody doesn't have to draw retirement in order to draw in order to start receiving the Medicare. You can wait till 65 to get the check, but you can definitely sign up for Medicare at 65. If somebody is found eligible for Social Security disability benefits, they also get Medicare, but after a 24-month waiting period, which is a really long wait for individuals. Luckily, there is the affordable health care that can be a bridge until that Medicare starts, which is fantastic. And we'll talk about that more on Tuesday. If somebody has end-stage renal disease, they can receive Medicare. And those individuals are working with the clinics and hospitals, and so they're going to get them signed up for that as soon as possible. But they don't have to be receiving disability. They just get the Medicare. If somebody has ALS or Lou Gehrig's disease, they do actually have to apply for disability benefits. But when they're found eligible, and those individuals are found eligible very quickly, they don't have the 2-year wait for the Medicare. So those are the individuals who are getting Medicare in the United States. First, we're going to go over the basic parts. There's 3 main parts and then 1 little extra rare part, I guess is what I consider them. So we're going to go over those quick. Everybody who is eligible for Medicare gets Part A, that covers hospital stays and surgeries. There isn't a monthly cost for that coverage. But if somebody has a hospital stay or surgery, Medicare Part A covers 80% of that bill, and the individual is responsible for 20% of that hospital bill. And so that can be very, very costly. If somebody does have frequent hospital stays or has a surgery coming up, they should definitely look into a supplemental policy. Those are private insurance companies, and they can look at policies for people to cover that 20% out of pocket. Those are anywhere between $70 to $270, but that's definitely less than 20% of a hospital bill for sure. People also get Medicare Part B, and that covers doctor appointments and outpatient care. There is a monthly premium for that. It's $148.50 per month. People also have co-payments, and there's an annual deductible of $203. So it is much less than most private insurance policies, but still there is that deductible. We're going to skip to D real quick. Part D is the prescription drug coverage, and those are also private insurance companies, but there are 29 different Part D plans for people who live in South Dakota. People should pick the Part D plan that's best for them based on the dosages that they take and the medications that they take. And then there are the Part Cs. Now, people don't have to have a Part C. Most people have A, B, and D. But these Part Cs are all private insurance companies or private insurance plans, and they can take the place of A and B or A, B, and D. And there's just a lot of different situations. They're very complicated, and people should never sign up for one of these without visiting with an insurance agent. You should never answer the phone and agree to sign up for one of these when somebody calls you on the phone. if somebody is getting Medicaid and Medicare, a Part C plan can really wreak some havoc on what Medicare and Medicaid will pay. But there are some individuals where a Part C plan is something that is advantageous to them. If somebody that I'm working with is interested in a supplemental plan to cover that 20% out of pocket for Part A, I send them to an insurance agent. So then I have them go over the Part C plans as well, and even the Part D plans. So those are the four basic parts. And just based on that basic information, you can see that there's costs involved for that Medicare. Medicare is very good coverage, but there are out-of-pocket costs, and they can be quite significant, especially for somebody who is on a fixed income. So next, we are going to talk about the different programs that can help pay those Medicare costs. We're going to go through these individually, but Medicaid can help pay the cost, the Medicare Savings, and the Extra Help program all help to cover Medicare costs. First, we'll talk about Medicaid. So if somebody has full Medicaid and Medicare, number one, these guys are very lucky because they have the best coverage of anybody in South Dakota. But Medicaid can cover all or most all of those Medicare costs. If somebody has full Medicaid because they get SSI, Medicaid is going to cover all of those Medicare costs that we just reviewed, all of them. If somebody has full Medicaid because they are with a HCBS waiver, or because they have it through the MOD program, or because they have it because they are a DAC, that full Medicaid will cover all of the Medicare costs, except that individual might have to pay their Medicare Part B premium of $148.50 if that person's countable income is over $1,308. That person will, if their countable income is over that amount, they will have to pay that Part B premium, but that is the only cost that they have. So if somebody has Medicare, but they also have full Medicaid, they are in good shape because Medicaid is going to cover almost all or all of those Medicare costs. So if someone doesn't have full Medicaid, they might be eligible for one of the Medicare savings programs. And there are 4 of these: the qualified Medicare beneficiary, specified low income Medicare beneficiary, qualified individual program, and qualified disabled and working individual. They're very wordy, but they are very complicated. So we're going to go through each of those individually. So one of the programs is the QMB. It's the best out of all of the Medicare savings programs. It covers the most. If somebody qualifies for this assistance program covers their Part B premium of $148.50. This program also covers the 20% out of pocket that somebody might have if they have a hospital stay or surgery. It covers the co-payments for appointments. It also covers the annual deductibles. This program covers the most. In order to be eligible, an individual has to have countable income less than $1,073.33. By countable income, they are talking about all of somebody's unearned income, but then just half of their income from a job. Very much like that SSI calculation that Barry talked about, Tuesday. So if somebody is working, they still might qualify for this, but because they look at half of their income, they like it when people work. And if somebody is receiving assistance through this program, they have to have resources less than $7,970 for an individual and less than $11,960 for a couple. This is the best one. Now, when we're meeting with somebody, if they're receiving assistance through the QMB program, we do talk about the fact that income could make them ineligible for this, but we also talk about those supplemental plans. losing this shouldn't be the decision maker for somebody whether or not they're going back to work. We want to give them all of the choices. I'm going to send them to an insurance agent so they can sit down and go through some of the different supplemental policies and how much it would cost for them to see if it would be worthwhile to go to work and not to get this help. If somebody's income is too high for the QMB, maybe they'll qualify for the SLMB. The income limit is a little bit higher. They have to have countable income less than 1,288. Resources are the same. If somebody qualifies for this program, it pays just the Medicare Part B premium. And I say just, it doesn't cover all of the stuff that QMB does, but if it saves somebody $148.50, that is a lot more money in an individual's pocket each month so that they can afford to live. And then we also have the QI program. This income limit is much, much higher, 1,449. The resource limits are the same, and this also covers just the Medicare Part B premium, but there are a limited number of slots for this program. And so if somebody is getting full Medicaid, they don't have access to this Medicare savings program. That's why earlier when I said if somebody is under an HCBS waiver, and if their income is more than 1,308, which I'm going to flip back, that is, is that amount wrong? I have the wrong amount. So if that person has, if somebody is getting full Medicaid and if they have more than $1,308 in income, they don't have access to the QI. So those individuals may have to pay that Part B premium because the reasoning for that is so that people that don't have full Medicaid can, so they have room for other individuals for this program to save them some money. And then the last Medicare savings program does not cover the Part B premium. This program, the QDWI, is something that can cover the Medicare Part A premium for people who have worked themselves off benefits. They're in extended Medicare. Because when somebody works off of their SSDI check, they can keep their Medicare for up to 7 years. And we're going to talk about this more in a little bit. But even after somebody has extended that or exhausted that extended Medicare, they can keep their Medicare for longer than that. They just have to pay the Part A premium. And earlier I said that people don't have a monthly cost associated with the Medicare Part A unless they're in this situation. And then that cost is about $470 a month. It's quite expensive. So if somebody is in that situation, they can look at this program. So this program is for people who are working, and people can have around, I think it's $4,200 a month in income and still qualify. We don't see people using this program a lot in South Dakota because we have the MOD program. I have run into one person who exhausted their extended Medicare, but she was using MOD, and we're going to talk about medical assistance for workers with disabilities more on Tuesday. But she didn't need this program because she had full Medicaid. So I don't know if we've had anybody use this, but it's available. So the the four programs that help to cover Medicare Part A and B are the QMB, the SLMB, the QI, and the QDWI. Next, we're going to talk about the Medicare Part D. And earlier, I told you that there were 29 different Part D plans available to South Dakota residents, and each of them are private insurance companies. And so the monthly premiums and the co-payments vary depending on the medications that you take, the dosages that you take, and the plan that you pick. So there are costs involved with Part D, but there is also what's called the donut hole. When somebody has high medication costs, they can hit the donut hole. Each of these Part D plans are private insurance companies, and they only pay, they will only pay a certain amount. I think it's around $4,000. And once an individual and the insurance has paid a certain amount, they'll stop paying, and the insurance doesn't cover those prescription drugs anymore. The person then has to pay 25% of the total out-of-pocket cost until they hit a catastrophic level, and then the Medicare Part D will kick in again. And so there can be some significant costs for people if they are under a Part D plan and if they have high medication costs. But the Extra Help program can help pay some of those different costs. So there is the full and the partial Extra Help. If somebody's income is less than $19,320 in a year, they could qualify for the full Extra Help. That's around a little over $1,600 a month. Then the full Extra Help covers all of that person's Part D premium, so they have no premium each month, and they have very small, low co-payments. But if somebody has income that's higher than that, they could still qualify for the partial Extra Help. And that the person's cost is dependent on their income, but that still does help with those prescription drug costs. But more importantly, if anybody is getting the partial or the full Extra Help, then they do not hit that donut hole. They don't have that. And so that is really a big, big deal for a lot of people who have high medication costs. And Tara kind of talked about this in the last session. There are some people that automatically qualify for Extra Help. If somebody has full Medicaid, they automatically get it. No, it doesn't matter what they're earning, they automatically get it. If somebody is getting assistance through QMB or SLMB or the Q1 program, the Medicare Savings Program, they're automatically enrolled in the Extra Help program as well. So there are people out there who don't even know that they have Extra Help, but their medications are getting paid. Great, beautiful. But even if somebody doesn't have full Medicaid, isn't getting one of the Medicare Savings Program help, then they can still fill out an application, because the Extra Help income limits are much, much higher than the QMB, SLMB income limit. So somebody still might qualify. They would just have to fill out an application. And Medicare does mail those out every year, I believe. Earlier, I told you that when somebody is eligible for Medicare, they get A and B. They're actually automatically enrolled in A and B. People can decline the Part B. They just have to fill out a card and mail it back into Medicare so that they can disenroll them. And I have run into people who have done this when they first become eligible for Medicare. A lot of people, especially if they're young and they don't go to the doctor on a regular basis, they think, you know what, that's a lot of money, $148.50. I'm not going to pay that. I don't need it. I don't need it. You know, a lot of those people probably would have qualified for one of the Medicare savings. They just didn't even know about that either. So these people will drop that coverage. But then if they want it later, they will have a penalty for each year that they went without that coverage, 10% penalty. And that can get quite costly, and they will have that penalty for the rest of the time that they have Medicare. And with the Part D, if somebody is getting full Medicaid, they're automatically enrolled in a Part D, but other people have to actually pick a plan and sign up themselves. So if somebody declines to get a Part B on purpose, or just didn't know that they had to enroll, and then when they start having medication costs, find out that they should pick a Part D, they're also going to have a penalty, 1% per month for each month that they failed to enroll in a Part D, and that can also get very costly. And so they will have that extra penalty cost for their monthly premiums for the rest of the time that they have Medicare. So that can get really expensive. But if somebody's income is at the level where they would qualify for QMB, SLMB, or the extra help, then after they enroll back in Part B and D and sign up for one of those help programs, then that penalty can be wiped away, which is it has happened several times, which is fantastic for that individual. And so that's where some of these different assistance programs come in very, very handy as well. It can help people in difficult situations where they have extra penalties for years that they failed to enroll. Earlier, Bonnie told you that, of course, people, when they are looking at work, they want to know what's going to happen to their check, but they really, really want to make sure that nothing's going to happen to their medical coverage. They want to know both, but they really want to make sure that nothing's going to happen to their medical coverage. And we have nothing but good news for people when it comes to that question, because if somebody is getting an SSDI check and they're definitely still enrolled in Medicare, they're still going to get that Medicare. But even if somebody starts working, if they're earning $900 a month from a job, they're well under that SGA amount that Bonnie was talking about. And so they are still going to get their check and they're definitely going to get their Medicare. But if somebody has a full-time job offer and they work off of benefits on purpose, or even if they do it by accident, because that happens too, then they can keep their Medicare for up to 7 years or more after that check stops or after their trial work period months. They just have to keep on paying those Medicare costs. People can keep it for a very long time, but they have to pay those costs out of their own pocket. And if somebody works off of a benefit and somebody is left with just money from employment, all those programs look at just half of your income from a job. And so some people who didn't qualify prior, to working off benefits might qualify after. But people can keep Medicare for a very, very long time. They just have to make sure that they're still paying the monthly cost for those different parts. So this is something that we go over with people. Let's say that somebody is getting $900 a month in SSDI and they want to go to work. If they want to earn $900 from a job, that person who got the QMB is not going to qualify for QMB any longer. But we don't want to stop the conversation there. We want to continue to give them detail and identify, yes, so you are not going to keep that QMB program eligibility. You're going to lose that. But that person is still going to qualify for the QI program, because that program looks at all of their SSDI check and half of their income. And so that person is going to still qualify for one of the Medicare savings programs. And then I'm going to send them to an insurance agent. I have 2 of them that I work with. I'm lucky to have them, because I call them, they get them in, and they sit down and go over these supplemental policies with them. But that person might find a supplemental policy for $70. So they're going to have everything covered like they did with the QMB, have to pay the monthly premium for the supplemental. They're still going to be ahead by $800. So that's definitely a possibility. A lot of times people get the Medicare savings income limits confused with the SGA limits for Social Security. And granted, there are a bunch of different programs and they each have different rules. They each have different income limits. And that's why it gets so unbelievably confusing. But, that's what we can help them to do, is to help to figure out exactly what they're getting. Because I've had voc rehab counselors call me into the office and say, you know what, they said that they can only make $300 from a job. Otherwise, they're going to lose their benefits. Well, they're not talking about the SSDI. They're talking about the SLMB program or the QMB program. So then we can go into detail about that. So the extra help is also a big thing that people need, that we need to go over with an individual when they start working. And losing that extra help is a big deal to people who have high medication costs, absolutely. But the great thing about the extra help is that when somebody starts working, there is a grace period where they exclude that income for quite some time. It's at least a year, if not more, depending on when they start working. So that's something that we're going to discuss with that person. The extra help might be a big deal, but they still might have the opportunity to try work and see how it affects them. And if it gets close to the end of their grace period for that extra help, we can kind of brainstorm with them on ways that they can potentially, try to get back on. So that's kind of what we do with a lot of people once they're working with folk rehab, when they're asking about benefits and Medicare. Like I said, at first it seems like it's pretty basic, nothing that big, but there's a lot of big things that go on with Medicare and some of the different programs that help pay those costs. And quickly, a lot of times I meet with people and they are either under their parents' private insurance, or maybe they're getting private insurance through a spouse, and then they become eligible for Medicare. They have a lot of questions, and private insurance companies or private insurance policies and Medicare work very, very well together. Absolutely. People don't have to take Medicare if they have private insurance and if it's pretty reasonable. They can decline that Part B and D, and if they want to get them later, and if they identify and provide proof that they had that credible coverage, they don't have the penalty. But keeping both Medicare and the private insurance is a great idea. But again, if somebody has detailed questions about the private insurance and the Medicare, I usually send them to the insurance agents that I work with, because that's what they do and they're experts on that. I am absolutely not knowledgeable about insurance in any way. But this is something else that we help people with: the Medicare, the costs, and the programs that have. Are there any questions?
I am looking. It's a lot this afternoon. It is. To me, today's kind of, it's a lot. But if everyone wants to, if there's no other Medicare questions, we've got 15 minutes. Let's go back and do our last story problem. I didn't want to do it until after Tara had talked about concurrent, and then Rhonda shared about Medicare. Because this one is bringing it all together. So if there's a way, if you can get back to your case scenarios that were sent out, there should be one. I'm going to share my screen. It says bringing it all together. So this is going to be the whole basket full. Rhonda, can you see that okay?
I can.
Awesome.
Yep.
Thank you. Okay. So, and for this purposes, we're going to assume SSI is 794 because that's what our amount is for 2021. Okay. William is 18 years old. He receives SSDI of $400 a month. He has never worked since being on benefits. Assuming he meets the requirements for SSI, what should his SSI amount be? Okay, so I'm going to stop sharing, and we are going to, oh, I don't have it in here. Sorry, guys. Let's do it. We'll do this one quick together. Okay, I'm not going to fill out all the top. Unearned income. Unearned income is SSDI. That's $400 a month. Okay. Well, they say you get to deduct the first $20 of that. We'll take it. That brings countable unearned up to $380. Okay. There is no earned income. So that means this is all zeros. Okay. Total countable unearned income. Total countable, we put 380 in here. Total countable earned, that's 0. So the total of this column, I'm just kind of going fast, but I want you to. So we said for this purposes, we know that he's eligible for the base rate of 794. Okay, so if he had no other income, he'd have 794. Oh, total countable income. So we subtract 380. So 794 minus 380 is 414. So I'm going to show you a little trick when we get to the end of this. So $414.
Hey, Bonnie,
Yeah.
you're not doing your green.
Well, thank you for stopping, Brad. I will do that now. Thanks, Brad. Sorry about that, everybody. Okay, calculation sheet. I think you were following me. So if we were going to use the calculation sheet to figure out how much he gets, right? Because he doesn't have any earned income. We minus the 20, we got 380, take from 794. So his SSI would be 494, okay? So 414, no earned income. Gross unearned income is 400. Okay, that gets us 814. Basically, what that is 794 is our full amount, but they deduct $20. So 814 is 794 plus 20. So anyways, quick little math, little shortcut, so to speak. So then I'm going to stop sharing for that part. And let's go back to William. All right, so William decides to get a part-time job in January. He's going to earn $13 an hour, work 24 hours a week. He's going to spend $200 a month on specialized transportation. BR is going to pay for a job coach to assist him 5 hours a week. BR is paying the job coach $10 an hour. Okay, so even before we get to the next one, there's a few things we know we have to do. Let's figure out his monthly income first, right? $13 an hour times 24 hours a week, $312. Okay, and we know we're going to take that times 4.33, whoops, which gives us $1,350.96. So hopefully everyone knows where I got that. All right. We know he's got $200. I'm a note taker in early. So we're going to have that written down here so we don't forget that. Okay. What's the next thing? Oh, BR is paying a job coach to assist him 5 hours a week. Okay. 5 hours a week. But VR is paying it. VR is paying that person $10 an hour. But when someone else is paying it, it's a subsidy or special condition, you get to use this number. So we get to use the higher one because it's the value of William's work. So 5 times 13, $65. Well, we're going to take that times 4.33 because we're working on estimated numbers here. So that gives us $281.45 a month in subsidy, or actually special condition. You'll hear us probably lump them all together times 2. I hate typing when people are watching. Okay, so, okay, we have that figured out. So if we add our total deductions, right? Or work incentives. We'll add our $200 and our $281, which gives us $481.45. Okay, so this is just information we know we're going to need. So now calculate his new SSI amount. Well, he's concurrent. He's got both, so we're going to have to be looking also, he has to look at trial work period, he has to look at his EPE, what are his incomes going to be, what are his Medicare Part D expenses. Let's jump to those first. Will he keep his Medicare and his Medicaid before I leave the screen? He will, because Medicare comes with your tie to SSDI. You know he has that. Well, we know also, since this is less, he has that tie to SSI, so he keeps his Medicaid. When you're on Medicaid, you qualify for Medicare Part D extra help. So his expenses for Medicare Part D should not change. So we kind of jump to those, okay? Because the next part here, I think the best way to go is go to the calculation sheets. So first, let's figure out what's his new SSI amount, okay? We need to bring these numbers with us. All right, so I have them written down here. Calculation, there we go. Okay, so let's do this together. We already know that he gets his $400. Okay, we've got that. We already determined his gross earned income was $1,350.96. We did not have a student earned income exclusion. So we have $1,350.96. These seem complicated, but just follow each line. We use the $20 above, so we don't use it there. So we still have our $1,350.96. We do get to use our earned income exclusion, which is $65 since he is working. So $1,350.96 minus 65. Okay, so now we've got our countable down to $1,285.96. But wait, we know that we had IRWIs, right? Remember, we had $200 in an IRWI, and that does count for SSI. So now we're at $1,085.96 is countable. The best work incentive when you're on SSI, when you're working, is when you get to divide that by 2. So now we're down to $542.98. Okay. No BWIs because we're not working with a blind individual. $542.98. Okay. So we've taken his earned wages of over $1,300 and they've been brought down to $542. We already figured this part up above the last time. Total countable earned income. We're going to bring this number down. $542.98. Okay. We're going to add those together. And we get $922.98. Okay. So now his total countable income is $922.98. Well, what happens? The base SSI rate is $794. $922.98 is more than that. So his SSI payment will be 0. Okay, so he does have, people are like, you know, they worry it's 0, that their SSI goes to 0. But remember, we get to keep that $1,350.96. I always say you forget about your paychecks. Plus, you're getting to keep your $400, we think. And then you had $200 in IRWIs here. So your total, we always put them there because IRWIs should be something that they're paying for. So we like to show that they come out of that total financial. So if you take your earned income and you add your 400 and you minus 200, $1,550.96. Don't get too wrapped up in this being over SGA. I jumped ahead. We're gonna look at some work, you know, we already know we have some work incentives. So anyways, people that say, well, I don't want to work because I don't want to lose my SSI. Well, $1,550 is much better to live on than this, what do we figure, $814 that they have if they don't work. I'm now going to go to quickly trial work chart. So in our calculation, at first, we know he works 24 hours a week, $13 an hour, but this is his first job, right? So he still has his trial work available. So those wages, we did the math earlier. I plugged those in. And I knew just, this is kind of an easy one, right? Because those 9 trial work months are all right in a row. So 1, 2, 3, 4, 5, 6, 7, 8, 9, okay? End of the trial work period, right here in September. We know October, no matter what, after work, Social Security does their work review, because we're gonna call them and say, hey, I used my trial work, will you please do a work review? We know the EPE starts here. We also know we can start using those work incentives. Remember this number, that 481? You take his gross wages, you subtract out those, the ERWI and the subsidy, brings that earned income down to 869.51. So that's why I brought that up with the trial work chart, to not get too worried about this number. Because now his countable earnings, they're below SGA. EP has started, but he's gonna, if this continues, remember these are all estimated, we are showing that while he's earning $1,350, which is over SGA, he's gonna continue to get his full benefit check. So that's why we kind of do this one, to just show you, you know, you got to bring it all together. And again, we do not expect you guys to sit down with someone and be able to do this. What we're looking at is having someone that you can just identify, hey, there's a lot going on here. What we don't want to happen is to have you say something in which I don't want you to just, you know, oh, I lost my train of thought there. What I'm saying is, help us encourage people to work. You know, we joke about, you know, we're work cheerleaders, but that's truly what we are. And hopefully we can stop people from hearing at the grocery store, oh, you can't get a job here, you lose all your benefits, because my sister's daughter's cousin, she said, you know. I've even had someone take a check to the bank and try and put it in the bank and have the teller say, you can't put this in your account, you'll lose your Social Security benefits. It's like, that's not true. You know, there are instances, they're very rare. There are instances in which someone could lose a benefit, or it could, you know, be a detriment. 99% of the time we can help them see, because like Barry, I remember Barry talking about it, and it's so true. It's not only about the money, it's getting to get out of the house. Let's face it, a lot of us, you know, our coworkers are our social life too, you know, and it's getting to see them. And so there's such a value in working, and anything that we can all do as a team to encourage that is very good. A couple housekeeping things. Yes, I will work on, I know I sent out the SSI answers. I will work on sending out these. Let me get them typed neater than what you guys saw today. So I'll probably get those out in the morning. You can be looking Monday evening or afternoon for those slides for our last day. Please, I encourage you to please join us. The MOD, ABLE accounts, housing. You know, sometimes people think, oh, I don't need to know about those, but there's some good stuff there. What else am I forgetting, guys? Oh, today's secret words, yes, buffalo and blue jeans. So trying to have a little fun with them. So those two words, buffalo and blue jeans. And the recordings, like I said, hopefully if you can't attend on Tuesday, we will put that up so you can get credits for your CESPs. It's bsnsd.org. I'll include that in the emails. We're here, make sure you're calling us. And we always tell people, it doesn't matter who you call, just call someone and we'll help find the person you're supposed to call. So anyways, hopefully everyone has a good weekend, and we'll see you refreshed and ready to go on Tuesday.